Guys, welcome back to my channel. Today our topic is fluidotherapy. So let's begin with the topic now. Here we are using the temperature as our main aspect to treat. There are superficial heating modalities and the deep heating modalities which comes under the thermotherapy. So let's see a few examples of superficial heating modalities. Those are hydrocollar packs, it can be paraffin baths, whirlpool baths, sauna, infrared radiation, and also fluidotherapy. Fluidotherapy is a superficial heating modality. The penetration depth for these superficial heatings are 0.5 to 2 centimeters. Now let's see about the deep heating. Few of the examples for deep heating are ultrasound, shortwave diathermy, microwave diathermy, laser, and the depth of penetration is usually between 3 to 5 centimeter. Okay, so let's see about the definition of the fluidotherapy. Fluidotherapy is basically a dry heating agent that provides mechanical as well as thermal stimuli to produce a therapeutic effect. It is a superficial heating modality. As you can see here, this is the equipment which is used for the fluidotherapy. Depending upon the area being treated, it is usually done for the upper limb and the lower limb. Now let's see how does the heat gets transmitted into the body. So it is transferred by convection method. Uh, the heat to the body by the movement of air or matter or the liquid around the body. During heating or cooling by convection, the thermal agent is in motion and the kinetic energy of the molecules is increased. So basically they move further apart and the part becomes less dense. And yeah, this is how the convection looks like. So there is basically a unit where the heat is supplied and there is circulatory movement of the particles are poured inside the container, so there is rotation of the particles inside the container along with hot air. Equipment required for fluidotherapy is it consists of a cabinet containing finely ground cellulose particles made from corn bob. Other particles are also used, but this is the most widely used particle, those that are cellulose particles that are made from corn bob. Heated air is made to be circulated through the particles so that the particles move like liquid. It utilizes a stream of thermostatically controlled heated air flowing over and through particles by an electrical fan inside a lid covered steel cabinet. So here basically as I showed you, this is how the inner circulation looks like. The hot air is passed, the movement is happening where the particles are being circulated. Let's move on. Yeah, so this is how it looks like. You have a sleeve like structure where you insert your limb and the particles are being moved. Now let's talk about the equipment parts. This is how the equipment looks like. It has a metal tank, a power control, thermostat to check the temperature, turbulence control, and a fan to circulate the air, and an auxiliary heater and entry sleeve where the part is being inserted through. Unit control, this is how it looks like. So here you can see the temperature settings, the pulse time, the preheat timer, the clock and everything. So according to the area being treated, the capacity of the person, the thing you are treating for, according to everything you can set the temperature. And this unit has a specialty that it can be preheated before starting with the therapy. Application, now let's see how does is it able to apply, how can we use it. So basically the unit is preheated to 38 to 45 degrees Celsius. Temperature can be checked by the therapist himself by putting his or her hand inside the unit and checking whether the temperature is comfortable. The patient's part is placed inside the cabinet and it is turned on. Treatment time is usually between 15 to 20 minutes. The lower the particle motion, the higher is the viscosity. Both active and passive movements are able to be performed. So even the therapist can insert the hand from the one side and can do passive movements along with the treatment given by the fluidotherapy modality as well. So this is one of the benefit of the fluidotherapy equipment. So yeah, this is what I was talking about. Here as you can see, the patient or the model is here, and the therapist can also insert the hand and help doing passive movement during the therapy. Preparations. So patient's preparation is that the part is undressed, like jewelry and everything is removed, and also skin sensation should be checked before starting with the therapy. And if there is any minimal open wound that which can be treated, it should be covered with a plastic sheet. Sleeve should be closed after the part is positioned to prevent the escaping of the particles. And yeah, so yeah, physiological and therapeutic effects. It will increase the circulation. Fluidotherapy will increase venous and lymphatic drainage, and also releases pain, increase metabolic rate, increase tissue extensibility, reduce muscle spasm, increase peripheral nerve activity, and also helps in increasing the range of motion. Indications. Now let's talk about the indications of fluidotherapy. So it can be used for stiffness, swelling, edema, decreased lymphatic flow, decreased range of motion, pain, contractures, and also to improve the tissue healing. So here are the few examples. This is the normal foot and this is the foot with edema. Contraindications. So the few of the things which we have to look for before doing the fluidotherapy would be fever or anesthetic area, or severe circulatory disorders, hemorrhage, heat sensitive patients, and also mentally unstable patients. Advantages of fluidotherapy: it is very easy to use, most body areas can be treated, it allows the therapist to perform some active exercises during the treatment, and also provides dry and comfortable heat, and can be used for desensitization treatments. Disadvantages is that the unit is very expensive. The patient may not like the closed feeling when the limb of the patient is inserted in, and some patients are intolerant to the part. Hope you guys understood. Please subscribe to my channel and hit the bell icon. Don't forget to like and share, and also comment down below which video you guys want me to do next on. Thank you so much.